The target is to vaccinate 60% of Africa's population by the end of 2022. The African Union's Africa Vaccine Acquisition Task Team secured a deal to source Pfizer and AstraZeneca inoculations from India. This is to complement the World Health Organization's COVAX facility, which has indicated it will allocate vaccines to cover only 20% of the continent's population. The continent's history with the rollout of HIV ARVs should enable this new campaign to be successful.
We have to have those vaccination points starting with the major cities, which means if we are going with the Pfizer vaccine, we have the -70s or the -20s for the Moderna and create those vaccination sites. Very similar to what we do with the polling stations. When we do that, we can store the vaccines and use them and move people towards the vaccination points rather than move vaccines towards people. I think that is one. Second is that we have to engage in a large-scale training of our healthcare workers on how to deliver the vaccines. And we, Africa CDC, are developing tools, training tools that will be used, of course, in collaboration with our partners to train large number of healthcare workers that can provide this the vaccination. The third is the supplies, not supplies for vaccines, but as the auxiliaries, that is the needles that will be required, the curtains, the alcohols, and every other things that are actually needed for this. So we have to have that in place. And lastly, a good information system to record people so that when we vaccinate, most of these vaccines, the early vaccines are single-dose vaccines. They are double-dose vaccines that require that you get a shot today, and then after 3 weeks or 4 weeks, you get a second shot. That will require that we get a very good system in place to track people and bring them back.
Trade and Finance Institution Afreximbank will provide financial support to member states in securing the vaccines.
After receiving firm orders from member states, which will be accessed through the platform, that is the African Medical Supply Platform, the bank will provide advanced procurement commitment guarantees of up to about $2 billion to manufacturers on behalf of the African Union members. Then upon delivery of the vaccines, countries may pay using their internal resources or access an instrumental payment facility of up to 5 years offered by the Afreximbank.
As numbers continue to surge in most parts of Africa, the CDC director says that any early introduction of the vaccine will help the situation. Statistics show that the current fatality rate of 2.4% is above the global rate at 2.2. He says once the rollout program begins, there shouldn't be any interruptions in distributions.
Once we start vaccinating, trust me, Coletta, we will not have disruption in that. I think we are optimistic that the pipeline for vaccines will ease with time, over time, and based on other arrangements that we are doing, which of course is too premature to be discussing it now. We have both bilateral and multilateral that they will have a consistency in the supply of vaccines. I think I'm not so concerned with that. I'm concerned with getting started and using a stepwise process and in a phased manner, which means we start with our healthcare workers and the vulnerable and start vaccinating those as soon as possible, learn from that experience, and as we roll that out and as more vaccines become available, we open that into the reality of our own continent. I think that is clear, that we need to also factor the fact that 80% of our economy is informal, and say, okay, how do we expand these vaccines to the informal sector, like the young people that are out there hustling to earn $1 or $2 a day, and with all the motorbikes, the bus drivers, and others. So that's where the community engagement component is so important.
Ngega Song says they'll submit a proposal during the upcoming African Union Summit to harvest commitment in boosting public healthcare for Africa.
We currently are in need of 6,000 epidemiologists. We only have 1,900 epidemiologists on the continent of 1.2 billion people. So there's a gap right there of about 4,000 epidemiologists, just epidemiologists alone, not to talk of laboratory experts and others there. So again, in the spirit of a new public health order to prepare the continent, we need to invest in that area.
An online platform which will detail the country allocations for the vaccines procured by AVET will be launched soon. And since some countries have already begun securing vaccines, member states which do not order from the AVET stocks will have their allocations reallocated to others according to need and demand. Noma Bolani, SABC News.